South Africa is making progress, particularly in the Millennium Development Goals that relate to education and gender. However, it's not making any progress. In fact, may well have been going backwards on some of the health-related goals, particularly those for mothers and for children. What we've seen is that there has been a slight worsening from 1990 to 2000 and some beginning signs of improvement, particularly in relation to HIV. But not really for women who are dying in pregnancy still unnecessarily, and for children both dying at and around birth but also under 5. Well, the main drivers of those unnecessary and avoidable deaths in South Africa are really related to poverty and the deep inequalities within societies in South Africa, and so the government will need to do much more in partnership with others to address those underlying inequalities and take a focus on those poor people, particularly making sure that they get access to what we know to be effective interventions, quite simple things to do, like making sure that people have enough safe water to be able to wash their hands, making sure that women are able to start breastfeeding and maintain breastfeeding, that children are immunized, that women can deliver safely in a health facility where it's clean, where they won't develop a life-threatening infection or they won't bleed to death, and focus those efforts to really make sure that the poorest of the poor receive adequate coverage. And then you'll see the figures turn around. And those things are probably achievable. Some quick gains could be achieved in 1 or 2 years, others are going to take a bit more time. So to improve the quality of services here in South Africa, education and health particularly, will take kind of incremental investment and not looking for short-term gains, but sort of building more sustainable, equitable and quality systems.